Hello, and thanks for coming to the virtual Green Living Festival. I'm Jean Ponzi from the Earthway Center at Missouri Botanical Garden. And we, the Earthway Center, the Garden Sustainability Division, bring you this festival. It's the 19th annual one, the first solely coming to you through electrons to inspire and educate you about and support your sustainable solutions in everyday life. The Green Living Festival is presented by Ameren, Missouri. We thank our presenting sponsor, Ameren, Missouri, for energizing these efforts. On June 6, 9, and 11, we're focused on green living in general, energy, and naturescaping with live panels, family activities, workshops, and the presence of our exhibitors, our 23 exhibitors who are all experts in their field, bringing you ideas and options literally for your projects and the kinds of things that you want to do to live a little greener. Talking today with Laura Turner. She is a specialist in the area of health promotions for the American Lung Association. So take a deep breath. Grateful for that. I'm pleased to welcome to the Green Living Festival, Laura Turner. Hi, Laura, how are you?
I'm good. How are you, Jean?
Thanks. I always have to say, take a deep breath and appreciate it whenever I talk about air quality.
Yes.
Plus, it's a good reminder of the cyclical nature of sustainability when you go, then what? And what a gift to be able to do that in a healthy way. That's what you're working on, right? From the Lung Association, that health, that benefit for all of us.
Yeah, exactly. One of our taglines is, if you can't breathe, nothing else matters.
Oh, yeah. Oh, so true. So the American Lung Association in Missouri, part of a national network of state-based and perhaps some also city-based working groups like yours?
Mm-hmm. Yes, I cover Missouri, and because we're located in St. Louis, I'm involved in some local initiatives as well. That's where most of my work is, but we do some statewide work as well.
Another one of our exhibitors from American Lung Association's Community Air Partnership, Susanna Fuchs. Hope that everyone will check out Susanna's presentation also that covers things like no idling and our ozone pollution prevention and awareness campaign. But I think we need to talk about asthma. Yes, Laura?
Yes, yeah, asthma is definitely important when you're thinking of indoor air quality. So that tends to be one of our big focuses, especially in areas where there's more pollution and more triggers, like in St. Louis.
And let's see your slide about asthma, working on an asthma-free environment in our homes and our schools.
Okay. Trying to do it. It's not moving. There it is. Okay. And this slide kind of encompasses a couple different programs, but first with asthma, we have a program called the Asthma Friendly Schools Initiative, which is targeted towards school districts to be able to have a comprehensive framework to really make their school asthma friendly and kind of prepared through different tiers of efforts. And that can include usually training all the staff, like the school nurses and coaches and teachers, to make sure they are ready to handle an asthma emergency as it comes up, but also some more preventative efforts in making sure that they reduce any asthma triggers like mold or dust that can really trigger a lot of kids with asthma in their schools. So,
and how are we doing, Laura, with participation in this program in school districts in the St. Louis region?
We have a school that we're working with, a school district that is approaching, they're just kind of getting this started. And then another one that I'm aware of, there might be more in the county, that has kind of done it on their own, and they have their own version of it, but they have an asthma plan. Now, I don't know how much they've followed this framework, but it's kind of just our best practices that we share when we can. But we do have one school we're actively working with on it, and we hope that it'll grow from there. It takes a bit of a commitment, And we had an existing relationship with that school, so we've kind of taken little steps towards this.
Uh-huh. So if parents or teachers would like to learn more about this program and look at the possibility of working, and you said at a district level, is that the level of engagement that you have to have, or can you come in school by school within a district?
You could do it either way. I
Mhm.
think the way that districts work, especially with the public schools, it tends to be on the district level, but
Mhm.
um, really it could be done at the school level as well. So,
Mhm. One thing I wonder about, I think I know about this, using things like air fresheners, especially plug-in air fresheners. Is that something that is like not recommended in schools?
it's not recommended because air fresheners can be an irritant for someone with asthma. Um, I have asthma myself, so I know
Mm.
that that's one of the things that will bother my asthma. Just those strong fragrances and chemicals.
Mhm.
And so, you know, really what we have to go for is just trying to keep the air as clean as possible, and not worrying about covering up smells with other smells.
Mhm.
So
Mhm.
that's
Yeah, that's
definitely something.
always a part of our Detox Your Domicile educational program to talk about that, especially when you have to use electricity to
Yeah.
make those things work. Laura, what happens in the body with asthma?
So it happens in the tiny little airways in your lungs called bronchioles. And what they do is with someone with asthma, first of all, they have kind of a baseline level of swelling. They're a little more, those little bronchial walls they're just little airway tubes. They're a little more swollen than someone else's would normally be. And then when their lungs are exposed to a trigger, be it an allergen or something they're irritated by, like smoke or air fresheners or
Mhm.
what have you, um, the little muscles around the airways will tense up and tighten, making a smaller airway. And then they'll react with some mucus to try to, it's the inflammatory response that happens in there. And all of that together, that underlying swelling and inflammation, the tightening of the muscles, and the mucus production makes for a smaller and smaller airway. And that can lead to coughing in some people, wheezing,
Mhm.
general difficulty breathing, and when it gets really bad, difficulty walking and talking.
Mhm.
So
Mm.
we want to try to catch it at the earlier phase with medication that's preventative, but also environmental control is very important for someone with asthma.
So can you tell me, Laura, I bet that there has been quantification of the cost benefits of prevention compared to the cost of medication in responding to asthma?
Of education compared to the cost of
Of,
medication.
of, of preventive measures.
Hmm. Yeah, and with asthma, some of the medication is considered preventive. It's kind of dealing with preventing an emergency
Mhm.
before it gets that far. So you want to keep a child or an adult with asthma out of the emergency room as much as possible, which is
Mhm.
really very expensive. So yes, there's, like many disease states, there's a huge cost benefit. And doing that education with them, making sure they're using their medication correctly, which a lot of people are not. It takes
Mm.
some education that a lot of healthcare providers don't have time to, and they're allotted 10 to 15 minutes. So
Mhm.
that's where people like us come in, and our partners that we work with that do a lot of that. So
Mhm.
um, yeah, every dollar spent in education and prevention of asthma triggers um, is very, very well spent.
Mhm. And then another program, smoke-free policies in multi-unit housing. Obviously, smoking is not permitted in schools. It's not permitted in many public places. We have banned it from our campuses at the Missouri Botanical Garden entirely now for a number of years. But when you have a number of people in the same building, the same stairwells, the same elevators, that probably is something different you have to address, yeah?
That's right. And a lot of people don't realize, landlords and residents don't realize their rights in this. Landlords specifically sometimes worry that they don't have the right to tell people they can't smoke in a rented property, but
Mhm.
there is really no right to smoke indoors, especially if it's not your property that you own. So this toolkit takes a landlord, and also could be a resident or someone who's just trying to advocate for cleaner air, takes them through the steps of what they need to know for what the rights are, both as a landlord and a tenant, and also how would you go into putting those policies in place in a way that really works and is effective, and is in accordance with your local laws.
And I think you have one more slide, Laura, that is, again, the basics about asthma, perhaps reiterating what I just asked about.
Yes, we'll go to that. Okay, so asthma basics is pretty much what it says. We offer it online and in person. And because of the pandemic, we've adapted the in-person workshop that can be done, live via Zoom or what have you. But anybody at any time can do asthma basics online for free. It's a really great just crash course in asthma. And it's a great thing for someone who has been newly diagnosed with asthma or wants to learn more about it, or maybe a parent who's just trying to learn everything they can, just to get a good idea of what the basics are and how they can prevent those flare-ups from happening. So it helps them to recognize and manage asthma triggers and understand the value of an asthma action plan, which is one of those ways that we prevent asthma flare-ups, and recognize and respond to a breathing emergency when it does happen. So education, like we said, is very important in asthma. So, and it's available in English and Spanish as well.
What are some of,
do that.
Sorry, I interrupted you. What are some of the common questions that you find when you present one of these workshops?
Let me see. I know we have a section on myths and facts. A lot of times people will ask if a person can grow out of asthma. And that is a common misperception. You don't actually grow out of it. You always have it, but your symptoms can subside. You can have your asthma under control, but sometimes that might change given your current circumstances in your environment. So that's one of the questions we get. And some people ask, can you get addicted to asthma medication? Because there's corticosteroids in it. People think that they put it in the category as other types of steroids, like anabolic steroids, which very different. Corticosteroids basically tame that swelling. That's why people take them. So they're not addictive. They work better if they're used regularly and you have fewer breathing emergencies. So there's some common questions we get.
Let's just the two of us talk here for a moment. So Laura.Turner, I want to ask you about smoke-free environments and how to prompt those. Because when you are around a person who smokes, I understand and appreciate that smoking is a very addictive behavior. It's very hard to quit. And, having been around secondhand smoke myself, it's not a pleasant experience. It's a concern. So what are some things that people can do to help mitigate that? What are some good communication strategies when you're around a person who's smoking to build their awareness?
Yeah, and my approach is typically from my reference point is from the living environment and working with multi-unit housing. So we're usually working with those landlords and property managers. We've done a lot of that recently because HUD had all their housing go smoke-free a couple years ago. And we worked with them to help them implement that locally. But really it's important to be able to offer the smokers an avenue to quit smoking and make it very available, and approach it as a partnership, and that, you're a team. They're not the enemy. You're not the enemy. It's for the good of everyone. It's for the good of even the smokers' air quality. A smoker can be healthier and breathe cleaner air if they're able to step outside and smoke and not be exposed to all that extra secondhand smoke. So I think that's something that's good for people to realize. It's not, there's not winners or losers. Everybody wins.
Yeah.
Just a way of doing it compassionately and with steps that everybody understands and that they're educated about it ahead of time.
And in a green building, like say a U.S. Green Building Council LEED certified building, the regulation is no smoking in the building, and usually within 25 feet of any building openings, operable windows or entrances or loading docks. In a multifamily unit, especially in this time of COVID-19, you're talking about being able to step out on the balcony if you're lucky.
Right.
So not that much option to maintain
Yeah,
that distance between smoking and occupants.
it's true. And I think that's where it comes down to some creative solutions that the planning ahead can really help, to figure out how, what do you need to do? Do we need to build a shelter? Do we need to make it so that it's easier for smokers to step outside?
Mhm.
It really depends on the individual place, but we've worked with definitely some multi-level housing facilities and worked with them to figure that out in a way that works for everyone. But I think it's just important for landlords and property managers to know that it is within their right, and also for people looking for a place to live that they're renting or in an apartment, that it's
Mhm.
okay for them to ask if smoking is allowed or if it's not. So
Mhm. Mhm. So, Laura, since smoking flipped literally from being something that was, we saw it in the movies and doctors would advertise cigarettes on TV, since the public perception of smoking flipped to not allowing it in many public places, what kinds of changes have you seen as a health promotion specialist?
there's definitely, we've seen that the percentage of people who smoke has gone down.
Good.
Um, lately, though, when we're talking about new smokers, it's more vaping than anything,
Mm.
with new people starting smoking, and that's typically in middle school and high schoolers. And then a lot of the people we work with who are having trouble smoking have been doing it for a while, so they're adults, and their level of addiction is a lot higher. We're seeing that people are um, who have maybe co-occurring issues that make it harder for them to quit smoking. They're the ones who are, many of them are still smoking, and those are the folks that we are helping to quit
Mhm.
with our program. So yeah, the numbers are going down, but we're learning that we need more tailored approaches that work for those specific groups, like in behavioral health and people with substance abuse disorders. It's going
Mhm.
to look different from someone who doesn't have those co-occurring disorders. They need kind of a tailored approach. And
Sure.
we like to work with our partners to try to figure out the best way to do that really works for them.
And there are some really strong partnerships growing between environmental concerns like recycling and composting and energy efficiency in schools and public health concerns like the asthma prevention and the asthma awareness and action that you're talking about. It would be great to see some good case studies of that kind of collaboration and maybe some cross-pollination between American Lung Association programs and the Green Schools Quest of U.S. Green Building Council.
Oh yeah, that's a wonderful idea. Well, there's lots of possibilities out there. So maybe you and I need to talk about it.
Well, and U.S. Green Building Council is one of our exhibitors at the Green Living Festival, along with the American Lung Association. And that's a way in which our Green Living Festival attendees can potentially do some of that cross-pollination in the schools and the school districts where their children are learning. So these are great resources. Thank you, Laura Turner, for sharing them with us.
Well, thank you for your ideas, Jean. There
Always like to seed another project.
you go.
Laura Turner, Health Program Specialist with the American Lung Association. Thanks for the work you do. Thanks for joining us today.
Thank you.
The Green Living Festival coming to you virtually in 2020. Thanks to our presenting sponsor, Ameren, Missouri, from all of us, the staff and volunteers of the Earthway Center at Missouri Botanical Garden. Please visit all, if you can, of our 23 exhibitors. We have these little interviews archived online at mobot.org/greenlivingfest. And there is contact information so that in the same way that you would talk to our exhibitors on a day-long festival in person, you can get in touch with them if you would like to implement any of the ideas that you're hearing about here. Sustainable solutions for you. That's our tagline at the Earthway Center. June 6th, Green Living Day, June 9th, Energy Day, June 11th, Naturescaping Day. Lots of recorded resources that you can view at your leisure and live events on each one of these days focused on those topics. mobot.org/greenlivingfest. Thanks for joining us. I'm Jean Ponzi, really appreciating the green things that you do and your participation in the 20th annual and the first ever virtual Green Living Festival.